Malala nomuntu wendulo avuke ancinde akhwife eMpumalanga abuye akhwife eNtshonalanga. So Dr. Dlomo, he is the current chairperson of the Portfolio Committee on Health in our national parliament. He is a qualified doctor who obtained his MPCHB in 1985. He also obtained a BA degree in UNISA. He also has got a master's in public health from Medunsa and a number of diplomas in tropical medicine, project management, HIV management, palliative care, postgraduate diploma in management and forensic pathology. Dr. Dlomo, joined the MK at an early stage, and he was involved in activities of the MK in a unit called Butterfly Unit in Durban, got arrested on Christmas Day in 1985. He was part of the Durban 12. He got sentenced for 12 years in Robben Island, one of only 2 doctors who actually served time in Robben Island. When he came out on Sharpeville Day in 1991, he went back home and served the community as a GP, working with Dr. Ngubane, later as a mayor, and also as a lecturer in public health. He also played an advisory role to the Dean of the University of KZN Medical School, and also a political advisor to the former Vice Chancellor. He also played a role at the South African National Defense Force, where he was a brigadier general in the military health services. Later played a brief stint at Tekwini municipality looking after health and social services. And then he became a MEC of health from 2009 up until 2019. And now he is the chairperson of the Portfolio Committee on Health. So welcome, Dr. Dlomo. I had to give that profile because that's all what you have done for this country.
I'm very humbled by that. I was almost about to leave your interview and run away when you say so many things about me. Thanks.
But everything that is there is very, very true. We owe the freedom that we have to people like you. All right. Today's interview is going to touch on about 3 broad areas. The first area is around the current COVID-19 pandemic. And then after that, we will then zoom in to issues around the Cuban, medical brigade. And then if we have time, we will also touch on issues relating to NHI. So in terms of how South Africa is handling the COVID-19 pandemic, as the person who is sitting, looking at the health portfolio, from Parliament, liaising with the minister and the MECs and all relevant people. From your vantage position, Doc, how would you describe our response as a country to the pandemic?
Thank you very much, Dr. Fundile, for that introduction of myself into this interview, which is very unique. I appreciate the opportunity. The starting point is that it was so opportune for those who really advised our minister and our president to really do the lockdown time at an opportune moment, at the right time. It was so timely when you compare ourselves with the rest of the world and the countries that have really been ravaged by this pandemic. It was just the right time for the lockdown into our country. Yes, it came as a surprise to some of the other people, but if we had delayed for about a week or 2, we would have been in a worse situation than what we find ourselves in now. because the lockdown situation has actually assisted our government, ourselves, to really make people to go to an end point and close out the space for whoever is a suspect or has been infected. Worse now that as we are informed by specialists, sometimes you walk around already spreading a virus, but yet asymptomatic yourselves. So
Yes.
that is actually another problem, that you don't wait for people to sneeze, cough before then they spread. They spread it even 3-4 days before they are symptomatic. Number two, what we see in South Africa is unprecedented in the world, where having seen cases by cases of people who are coming in reporting that they are unwell and therefore tested, and you end up getting them COVID-19 positive. Recently, the country has gone into a mood of massive screening, so that you go out there to people in Kunu, Kumbu, Mbumbulu, who otherwise would not have been picked up if we did not do the massive screening, and then test those who there's history of actually being found to be either positive or have had a contact. Now that is unprecedented in the world, and that is what we find amongst us in the country. But the continuous, the way Dr. Mkhize has navigated the whole country, jacking up all other MECs, get them supported, doing this, and really coming into work with the private sector, bring them on board, mobilizing like the army to be also assisted. All of us have been like mobilizing to like an army of South Africans against this COVID. That, I mean, the crown of it, Dr. Nyati, was when a few days ago, Dr. Mkhize was invited by the World Health Organization to say, we face the pandemic in the world, but Dr. Mkhize and South African government share with us their success stories. So to me, that was the crown, that was the cherry on top in the terms of our campaign as a country.
Yes. Now, a few days ago, the Human Science Research Council released results of a study that they've just done, which is more looking on the social aspects, of the pandemic. And one of the findings that came out there was that in terms of awareness levels across the country, at least 3/4 of people are actually aware about COVID-19 and how it's prevented. But there was an issue about that awareness level. It did not translate into risk perception. Many of the people did not see themselves as being at risk, as much as they know about the disease, but they didn't see themselves at risk. Almost 50% of them, they said they've got low risk, and another 25%, they said they've got moderate risk. So, that was something of concern as to why our people, they have the knowledge that there is this big thing that is causing, severe illnesses and death elsewhere and also in this country, but they don't really see themselves as at risk. Would you like to comment about something like that?
But I give credit to, we see, when this process started, we had a debate in Parliament, in the National Assembly on the COVID-19. And coincidentally, that was the first day we got the first case of a patient in South Africa who had COVID-19.
Yes.
Well, among other things we raised with Dr. Mkhize there was to say, look, we don't think that we are even at the level of improved awareness. South Africans out there are not even aware there's COVID-19. Can you please accelerate that process in all 11 languages? Do your best. That part, we need to give credit to the department and government for actually accelerating the awareness messages in all languages. Yes, there has been some criticisms here and there, which we need to understand that most of the time when the department, and in particular Dr. Mkhize, is on the podium, he speaks in English, which is understandable because that's a language that is understood by most South Africans, whether you're in Cape Town, Kumbu, Kunu, or Ladysmith. Now, we need to also become soldiers around him and translate and take such messages into other languages. And that is where maybe we can strengthen this issue of people understanding that the risk behavior is not just out there far away. I mean, this week I was speaking on another channel in Zulu, and I was saying in Zulu, we thank the South Africans, maybe the young, especially the young people. Let's do it for our parents. Let's do it for our grandparents, because if I'm blocked to go to the gym, to the nightclub, to all the nice places, I am avoided to bring back a virus, which, by the way, may not do any harm to me because I belong to this 80% of people who are getting a mild infection. Now, parents and grandparents. So those messages said in many languages will probably maybe improve this risk behavior adaptation and knowledge among South Africans.
Yes, and also some of the things that came through is that, you know, the socio-economic impact of the lockdown, especially to the most vulnerable people who are in townships and rural areas, has been quite heavy. You know, these findings were released just 2 days after the president had released his, you know, the government's socio-economic relief package. And so interpreting that, you know, one said the government was actually ahead in terms of providing that kind of, you know, a relief, not knowing that actually 2 days or 3 days down the line, the findings will actually be also confirming that people on the ground are actually suffering as a result of not being able to generate income, not having food and things like that. Would you want to just comment around the socio-economic impact?
Kanyati, you will realize that when the president made announcements that in the next few days we are going to have a lockdown, South Africans who are like me and you, who probably have got reserves financially, were able to go. In fact, that is why Minister Titiza even said, let us stop going to supermarkets and stockpile food. Because a lot of South Africans went in, those who had money, they bought food that probably can last them another 3, 4, 5 months. Now, even if you wanted to do that in Kumbu, very unlikely, because a lot of our people are dependent on the social grants. So they will have to wait for the month end to get a grant and go and buy just that which is going to take them to the next 30 days and then again go. So that is why you're finding that South Africans, especially from the poor communities, have actually had this hitting them hard because they're waiting for the grants to move around. They are unemployed, they are sitting at home waiting for government support. Only then they can go and buy. So it's probably not so much about not them respecting the protocol, the regulations of the lockdown. It's more about what am I going to eat tomorrow? Only today I got paid, only today I got my grant money, so I must go. And that's why we have been seeing long queues and people all over looking for places where they can buy. Other people were probably like me and you could go and stock. They are not there. We don't see them as much as we see poor people on the supermarkets.
Yes. And then another unlikely finding from that study was that people who were on chronic medication, who are taking treatment for diabetes, hypertension, or other chronic illnesses, for some reason, the challenges around the lockdown actually affected their ability to access, their ability to access their necessary treatments. What would you say around that from now provincial and maybe local government level in terms of ensuring that there's continuity of care as we focus on COVID-19, but those people with chronic illnesses can also, get treatment as well?
Yeah, no, it probably speaks to this program that the government initiated, which we welcome, the chronic CCMDD, chronic medicines dispensing and distribution, which must then be accelerated. But again, I'm not sure whether it is related to because not everybody in South Africa can just walk into the clinic. So there'll still be a need. And when there's a lockdown and it says transport is available between 6 in the morning and 9, and then you find that in the clinic, you probably finish at 11, and people probably were discouraged to go to the clinic knowing that there is no way of coming back until maybe 5 o'clock in the afternoon. It probably could have affected that in terms of the access. And again, the shortage of cash availability for them to transport, to go there, could have affected those processes. But I was not aware, I haven't seen that study, but I believe you when you said there is that information that patients with chronic medication did show a bit of less numbers accessing their medication during this lockdown period.
Yes. All right, now let's leave this study, Doc. Now, there's been an outcry by the frontline essential services workers, especially medical people in hospitals, about the shortage of PPEs. But obviously that increases the risk for them as they go about trying to save lives. So what would you want to say around that in terms of government efforts to try and address that problem?
Yeah. No, I'm encouraged because each time we talk with Dr. Mkhize on this point, I'm extremely encouraged. He always says no healthcare worker should be exposed to a working environment without the protective clothes with him or her. So that means it's his determination, his commitment to this process. Now, even when I was an MEC for health, if someone were to say, I'm in this clinic, there is no tablet or medication, would you say yes or no, Dr. Loma? I wouldn't say no or yes, because I would not have known. Logistics will be such that in every hospital at every given time, there has to be adequate of these PPEs. Now, it may as well happen that not all hospitals at any given time will have enough and adequate. But just 2 days ago, in fact, 2 days ago, we had a virtual meeting with the minister as a portfolio committee, where he categorically says he's going to do everything in his power and to support those provinces. We know some of the provinces that have not been doing very well. He has actually dispatched some DDGs to go and assist and support and sit there and make sure that this province is able to deliver and get all what is necessary to make sure that no worker is actually exposed to a working environment without necessary PPEs.
Yes. All right. Now, there's also something that came out. Doc? I'm getting an echo.
Okay.
Is there somebody close to you who may be viewing this as well?
No.
Okay. All right. Let's proceed. Now, there's something that came out this past week, which points towards stigmatization. There are some people from a community, in KZN, who were quite unhappy that their local hospital has actually admitted patients with COVID-19. They felt consulted before the hospital can actually admit such people. Just what's your view? What's your view
Hello.
Yes, I can hear you, Doc.
Yeah. No, you remember, Dr. Nyati, the government planned to, they planned to bring South Africans from Wuhan province to our shores. And various communities were actually saying, we would not want to have these people coming in. I mean, these were South Africans. We would not want to have these people coming in to our area, to a clinic or to a hospital or a hotel next to us. And the government had to really get into various meetings and actually assisted by a premier of a particular province in terms of that regard. So the fear among South Africans is that, I mean, it's like they don't know that this disease exists, and therefore bringing it across our road in this hospital might actually bring it to us. We are grateful about the leadership of the province that went to talk to these South Africans to say, look, these are South Africans. This hospital is earmarked to have them there looked after, quarantined, and be treated. So I think it's an appeal to South Africans, which should not go in the way. We have a Mini Park here in Durban, where it's named after a lady who came forward and declared her status as being HIV positive. For that, there were South Africans who gathered around and killed her. Now, we should also be mindful that yes, COVID-19 is an illness, but those who have it have actually been infected from various sources. It is not about them and us having to deal with them and discriminate. So it's a learning process, Dr. Nyati. We all have to socialize, conscientize our South Africans regarding all these programs and and bring solutions that are going to be very much, comforting to all South Africans.
Yes. Now, let me, okay. So let me move to another point, Doc. Yesterday, South Africa welcomed Cuban doctors. The country.
Yes.
I'm getting an echo, and I'm not sure why. Yeah. So South Africa received a contingent of Cuban doctors. Now, since their arrival, South Africans have been divided about whether their coming here is a good thing or not a good thing. Now, I just want you to maybe help those who are watching with understanding the historical relationship between South Africa and Cuba before we get to the merits of their deployment. You know, the relationship of solidarity between the two countries before we actually talk about the merits of why they are here.
In 1994, I think even before 1994, Baba Nelson Mandela was released in 1990. The first country, amongst the very first countries that he visited after his release was Cuba. And he was doing that because Cuba, our liberation as South Africa would not have come about if it were not of the lives and the support that we receive from Cuba. In Quito Valley in Angola, the fight that took place there with a South African Defense Force that was fighting a war against our MK was well supported by them soldiers from Cuba. In fact, later when President Fidel Castro was relating the story, he says, when we came to Africa, not only South Africa, we came to South Africa, we did not come to steal any gold or silver. We came with our soldiers and we took our dead bodies back home. That is, and he's not actually regretting, it's just showing how deep this relationship is, that Cubans have always been ready to come into Africa and share and give their best of the best without any expecting anything in return. In fact, some of them losing their lives. I have been to Cuba several times, as you probably are aware, that during my stint as an MEC, we sent quite a lot of students to go and train there as doctors. I used to ask Cubans, but why are you doing these things to us? Why are you so good to us? Then they say, you are so much part of us. A lot of us came from that continent. In any event, we are the people of the world. When we have an opportunity to give our best to you, we will not hesitate to do so. So that has been an issue, and therefore it was so easy for when we had our liberation and democracy in 1994 for President Nelson Mandela to say, Dr. Nkosazana Dlamini Zuma, among other things that you are actually struggling with is a contingency of healthcare professionals, particularly doctors. We have talked with President Fidel Castro. Please do what you can, go and recruit. Right now, that program has never stopped. Before we could even send our students to Cuba to go and train as doctors, a lot of Cuban doctors came to our shores, and to date they are still here supporting us in an unbelievable way. So that is how close this country's relationship has always been.
Yes. So with them arriving, yes. Now, there seems to be some information that was leaked by whoever, which relates to the costs of their stay here. And that has made South Africans to actually be up in arms, because they say South Africa has got unemployed doctors, retired doctors. Should that money not have been used to actually engage South African doctors first before bringing people from Cuba?
Dr. Nyati, I want to give you an analog here. When I was an MEC for health in KwaZulu-Natal, we once had a dire need for oncologists. Even though we had machines in our hospitals, we needed warm bodies called oncologists. We were ready to recruit from India, from all over the world. For all I care, we could have brought in Cubans to come in there. There was no one willing and available, very few coming in from the private sector. Despite that, in Durban alone, we have got over 50 oncologists, but none of them were easily available to come in and give a backup. For whatever reasons, whether our hospitals are not clean, there's no equipment, but that was the bottom line. There was no one who was available and willing to give support. For all I care, we could have recruited Cubans who were specialists to come in there and support us there. We could have recruited anybody because we had made that pronouncement. Now, this issue of the Cuban specialists in our country, from the history of the world, there is no country in the world that has got international experts on public health that can surpass what Cuba can offer you. And here we have got specialists who are epidemiologists, virologists, immunologists, family physicians. That is, they're not taking a job of me and you who are medical officers here. Let us separate a program where we should continuously engage government about those doctors who are unemployed, if they are, and they get them to be employed in those posts where they should be. But those are not immunologists or virologists you are talking about. This batch of Cubans are people in the world who have been able to deal with outbreaks throughout the world, who have been able to support. They did not bring very junior doctors here, from what I gather from Minister Mkhize. So let us separate these issues. Let us continue to engage the department, the government with regards to further employment of professional healthcare workers and support the program of getting specialists from Cuba who are the best in the world in terms of public health outbreaks, who are going to be supporting us here. On an issue of the cost, no life is too cheap to be condoned down there. So I think we are bringing South African Cubans to support us on a program that is going to improve the lives of South Africans. Now, I can't compare any life with the money. That is why we are actually saying, even on the NHI, we should be mindful when people are telling us that we are comparing money with human lives. Human lives can never ever be compared to money. We need to spend, we need to have money to save lives. And if it so be bringing Cubans here, let us do so, because they are coming in to provide the support that we do not have. If we do, it's probably sitting out there in private sector.
I hear you, Doc. I hear you very well. In fact, some of the views from some South Africans are actually saying exactly the same thing that at the beginning of April, the Department of Health issued a gazette asking for people respond because there's a shortage of healthcare workers across the country. And the understanding is that the response hasn't been that good. And so why now people complain when they see that there are Cubans here? The other view that is being shared is that South African doctors are not keen to go to rural and outlying areas. They want to work in urban areas. Would you want to share, your view around that?
Exactly so. I've also got an experience of that, and probably if I were to just use an example of KZN, Port Shepstone is not that rural. Newcastle is not that rural, but you struggle sometimes to get specialists to go and work there. All of them would want to work around Pietermaritzburg and Durban because it's nearer this, that, and the other. So you have also, it's from time immemorial that this country has always relied on specialists from outside our borders who have been willing and available to go and sit on the outskirts of the main cities of our country.
Okay. So now, what would you want to see around South African healthcare professionals as opposed to doctors from places like Cuba, in terms of maybe I would say patriotism or willingness to assist wherever it is within the country?
I like the message that I listened.
Doc? Doc? Right. We seem to have lost Dr. Dlomo there. I'm hoping that he can come back on stream. I'm not sure what is the actual problem there, because we were still going through with our interview nicely. I'm not sure what actually happened to him. You see, the line of questioning I was still trying to follow was a questioning around, the prevailing view that South African doctors don't really want to go to outlying areas. They would rather work in urban centers where, it's very, easy to have access to, a lot of things, and the hospitals are much more developed. So the view that is out there is that people like the Cubans actually have the right attitude of ensuring that they serve in whichever part of the country where they are needed. And maybe my question was around, is there anything as South African doctors that we should learn out of that kind of, attitude by, the doctors from countries like Cuba? Now, I'm just trying to see if we can get Dr. Dlomo back, because I'm not sure why he is now not coming through. We sincerely apologize for that. Sometimes technology doesn't always work with us, but we are trying to get him back online so that we can finish our interview. Sorry about that. That was Dr. Sibongiseni Dlomo. He is in KZN in Umbumbulu, and they've just had a situation where electricity has just decided to shed itself, So he's just had some power outage in the area where he is. So they are trying to connect back to us using his cell phone, and hopefully that will work because we were still, in the middle of our interview. You see, I needed to get these answers from Dr. Dlomo because when one looks at the social media there's opposing views from South Africans. There are those who feel that the country should prioritize its people first before it looks outside, and employing people from places like Cuba. But then on the other hand, there are those who feel that there is unique expertise that is with the people who come from Cuba. And it's important that that expertise is leveraged because they, as a country, have got experience in dealing with these epidemics and pandemics. In fact, in 2014, they were actually the people who were brave enough to go to West Africa and help a number of countries in West Africa that were battling Ebola. And I mean, if one compares Ebola to COVID-19, in Ebola, there's a 90% fatality rate. So out of 10 people who are infected with Ebola, at least 9 of them, they pass away. So, but the Cubans, in spite of that huge risk to their lives, they went to West Africa, and they were successful in helping those countries to deal with the epidemic of Ebola. And even now with COVID-19, they have been able to go and assist places like China. They have been able to go and assist places like Italy. And so they are coming to South Africa to also assist, yes, based largely on the past relationships between the two countries in terms of the struggle. But beyond that relationship, there's other reasons, which is basically the expertise that they have in dealing with epidemics. Some of the issues that people are raising is that looking at the costs that were leaked, the costs relating to their remuneration, costs relating to their accommodation, costs relating to other logistics, they come close to 500 million over a 12-month period. And it is that figure that made a number of people to be quite, unhappy that it's a huge amount of money when previously they were told that some posts could not be filled as a result of shortage of funds by most of the provincial health departments. There is a feeling that there isn't appreciation of local skills. Somebody made an example that when South Africa had a challenge, with ESCOM, again, the country reached out to Italian engineers to try and help to solve the problem when South Africa had a lot of engineers. Other people are saying, there seems to be differential treatment by our country, that is looking at what the doctors from Cuba are being offered as opposed to what our local doctors are being offered. But all of this, there's pro and cons, for this. There's also information that has come through that the SAA plane that actually went to fetch the Cubans actually went there with a lot of medical equipment, because remember, Cuba as a country is still under embargo, and so it's unable to trade openly with other countries because of the embargo that is enforced by the US. So those are just some of the things that I wanted to ask Dr. Dlomo about, because they are very important in helping us to understand why the government has decided that we should have the Cubans here in South Africa. So it boils down to the unique skills and insights and experiences that they have, and the fact that their training as doctors is largely focused on preventative medicine, as opposed to our focus here in South Africa, which is largely reactive medicine or curative medicine. So their training, which focuses on primary healthcare, as the base, and preventative medicine as the base, is actually, their strength. And we as South African doctors, we're very good when there's already an illness and how to deal with that. We've got the infrastructure, we've got, all the high tech. However, at times on matters of primary healthcare, we are found, wanting. So those are the issues that for me, I wanted to really address with Dr. Dlomo, who is struggling with connectivity because of the electricity challenge where he is staying, which is in Umbumbulu. So I'm just going to try him again and see if he is able to come through. Otherwise, we will wrap up the interview and hopefully we'll have time with him again. Doc, are you able to continue, or we can wrap up the interview? Okay. All right. Okay, we'll continue. We'll continue then. We'll continue. All right. So he is still trying to connect. He's being assisted by his, a daughter who is more tech savvy than himself. But I think as a country, a democratic country, a country that prides itself in terms of transparency, the issue of the cost of what it would take to have the Cubans in South Africa is something that maybe should have been much more open and transparent, because it's not like it's money that's being thrown down the drain. Like the doctor had said earlier, it is money that is procuring top expertise on matters of public health. Yes, we have those skills here in South Africa, but they are in short supply, especially provinces like my home province, the Eastern Cape, provinces like KZN, provinces like Limpopo, they don't have enough of that type of specialized skill. And because they are largely rural, they are not really able to attract those skills. So if the majority of these, Cuban doctors are actually going to be deployed in such resource poor provinces, then it's actually, not a waste of financial resources. It would also be nice to know, though, whether there is going to be a transfer of skills from the Cubans to our local doctors during their stay here in South Africa, so that as we move forward, we are less reliant on external help, and we only get that external help when it's absolutely critical as a country. Somebody else, just hold on. We're trying to connect with him again, and hopefully we'll be able to continue with him. He's trying to connect. I can see there. It's important that we finish this interview because there's a lot of good information that I expect to extract out of Dr. Lomo. So please bear with us. It's one of those difficult things, but I can see him. And I think we will be able to continue pretty soon. Doc?
Yes, sir.
Yes, I'm sorry about, you being load-shedded there in Umbumbulu. Yeah, but it's okay. I can see you. We can continue with our interview.
Okay,
Can
sir.
you hear me?
I can hear you well.
Right. No, if you can stay just the way you are, then I'll be happy. We can continue with our interview. All right. So when you disappeared because of the electricity that played tricks with you, we were still talking about the fact that South Africa has got this contingent of Cuban doctors that is made up of experts when it comes to public health, experts that are here to shore up or to strengthen what we already have. I was raising that because there were a lot of people in social media who were actually making a lot of comments about South Africa not prioritizing its own and actually seemingly prioritizing others. So what I want to know from you, Doc, is that looking at the 12 months that they are likely to be with us here, is there a possibility or thinking at government level that they should also be able to transfer skills, to some of our people, so that going forward, at least we can benefit from the expertise that they have been able to accumulate, having assisted, people in West Africa during the Ebola, having assisted China in Wuhan when this thing started, having assisted the Italians just a few months ago. So as a country, besides them being here, is there an idea of getting some form of skills transfer?
Dr. Nyati, don't make me a spokesperson of government.
No,
but,
I know. Yeah.
But the legacy of Cuban doctors all over the world is exactly the way you're putting it. Fortunately for our country, we already got a team of Cuban doctors who have been here with us over the past 20 years. But again, we have over 1,000 now of our own South African doctors who have been training in Cuba. So I think even the transfer of skills is not something that's going to be very difficult, but I would imagine our benefit will, among other things, do that, what they normally do when they've been to a country that is ravaged by outbreaks. They not only assist during the sort of the acute period of that outbreak, but as it tailors off, they then transfer skills and leave a legacy of their presence that has ever been there in that country.
Okay. Now, South Africa is obviously in a process now of planning towards the rollout of the national health insurance by 2026 as a country. Now, during this pandemic, we've seen a close working together of both private and public. And I'm just asking to see whether there are any lessons for both public and private, you know, with a view to the fact that we as a country have to roll out NHI in line with the WHO resolution that, you know, member countries should have universal health care by 2030.
Dr. Nyati, compare what we have seen in China, UK versus United States. Yes, China has also been ravaged by COVID-19, as much as it has also affected these other countries in Europe. UK is one of them. But the presence of NHS in UK and the presence of the universal health coverage in China, where you do not treat a citizen of the country based on the color of the skin or the wealth of the pocket of that person, has actually seen those countries managing this outbreak in a way that is whole humane and in a way that is actually very cost effective. I learned, and I've been checking, the devastation of COVID-19 in US has been largely affecting African American. Now, when you see in New York and largely other parts, now those are largely American people who have not been able to afford what other people have been able to afford: ventilation, ICU, pay for it yourself. So I would venture to say, if we had what we called an Obamacare taken up by this government that is currently there in US, we would not have had a devastation in US, predominantly affecting one group of Americans than the other. It is now, this COVID-19 is probably educating us that health is a public good. It is good for me as much as it is good for you. It cannot be. And I would say post-COVID-19, the greatest lesson for the whole world is that we need to be very mindful about universal health coverage as championed by the World Health Organization.
And now, about a week ago, I got, asked by people from Newsroom Africa. And they were asking me that, in Spain, during this COVID-19 pandemic, decided to nationalize their health system to ensure that, they can respond to the challenges on the ground. So this person who had written on the Mail and Guardian actually said, why is it that South Africa is not going that route? Now, obviously I had my views, but let me just hear from somebody like you. Spain is a different country, it's got a different constitution, and all of that. But generally, they have got about 15% of their people who are on the private healthcare, and the rest of the people are on a universal type of, a healthcare service. But the country, they decided that they want to have everybody, contributing, and they decided to nationalize that. Now, your view, something like that, do you think it would have helped South Africa, or going forward, if we get overwhelmed by the cases as we are still looking at the winter coming up?
Yeah, no, I think the COVID-19 found us already halfway in the process of completing the public hearings and consultation with the South Africans in the view of national health insurance. We have not, as a portfolio committee, submitted that to Parliament to actually get that process being completed. Now, what could have happened would have been the view of the minister, which he would have supported, but maybe we probably would have brought in a particular sort of exercise at a time where we need all South Africans, because he is able to command and get even the private healthcare sector to be part of this COVID-19. So maybe let's deal with that and get that sorted out, and keep it in our minds that we would have wanted to have worked within one single health system. However, if these two systems, both private and public, even at this stage can work together right until we are over COVID-19, that would be an amazing story, which I'm seeing is happening. But let us maybe postpone and come back to the national health insurance processes post-COVID-19 and just deal with this process right now. But taking the lessons that we are picking up of the world, of our country, towards a universal health coverage through this COVID-19.
As we are still talking about NHI, still, yes, I know we are in the middle of COVID-19, but how are the public hearings going in that area? You know, because you've been going from province to province, you know, meeting stakeholders and listening to people. Obviously, I mean, you're still going to release a report to the right structures, but at a high level, you know, are you getting a lot of support from South Africans around that direction?
We have completed the visits to all 9 provinces. What is now left is for us to listen to those South Africans, organizations, stakeholders who have requested to come and make their submissions in Parliament in Cape Town. That process will kick in as soon as we are able to go back now. But overall, in the provinces, we've been almost releasing reports as we complete each and every province, where people are saying, we've heard about this NHI. We thought we were coming in today to announce that we are starting on it. We can't wait to see it happening. Please go on and ask the president to really sign it into law. We have also had a group of South Africans who are saying, we would love to have NHI, but there are certain issues that we think must be sorted today. Among others were issues related to overcrowding in hospitals, shortage of staff, shortage of medicines, debilitated infrastructure, which are things that we have always been sharing with Minister. And if Minister Mkhize can then look into what they call a presidential health compact, which actually is a program that they've put for themselves, addressing all these issues that are there, we can go a long way towards stabilizing and getting NHI being well accepted. People have got reservations here and there, but overwhelmingly, people have actually accepted that this is the way to go. Let's actually support it. Yes, there are certain challenges here and there. People are actually saying, but with this NHI, aren't we bringing another ESCOM, another type of corruption? That must be addressed. We cannot shy away from such concerns of South Africans to say, I'm willing and available to support NHI, but please give me guarantees that we are not bringing another corrupt program into our country. So those are the issues that we need to address.
Yes. So basically, the process is on track. The legislative, or parliamentary processes, that are working towards that, they are on track, and we must just, wait for the processes to unfold as the South Africans. Yes.
Absolutely. Thanks.
All right. Now, as we try to wrap up now, I just want to go back to you. Getting, I read your book, Doc, and the idea of you being arrested on Christmas Day, I mean, how is that? And then you come out on Sharpeville Day, 12 years later.
Yeah, I was persuaded by by my daughter, who actually has been helping me to put this together. When
Yeah.
she asked me, "But Dad, why did you go to prison?" And I said to her, "Hey, it will take a book to write to explain all that." So I'm glad I did eventually write. And I'm glad you have had a look at that book, because it's very historic. You are right. Being arrested on a Christmas day, released on a Human Rights Day, spending so much time in prison, having visits. You are right. The best thing that I did not learn from medical school, which is covered in that book, is to how to become a doctor in prison and run a hunger strike and be actually and administer and support your comrades on a hunger strike so that they don't die, but they follow the cause of why they were on a hunger strike. So we had a hunger strike in 1990, and with Dr. Ramla Khan, we were part of, we were able to command and say, all those who are 60 years and above will not participate in the hunger strike. All those who are having chronic illnesses will not. So we produce protocols similar to the protocols we have now in the lockdown. And so it's one of those journeys, and I'm glad I've been able to pen it down there.
Yeah. Now, at a personal level again, you got married whilst you were a political trialist. Like, Uma Dlamini, her committing to a guy who was unlikely to come back, for a long time. You know what?
Dr. Nyati, that is why when you read that book, I always say she's a better person to tell a story, what really convinced her to do that. Not many people would do that. In fact, when we launched this book, Dr. Mkiza said, beautiful as she was, she agreed to marry someone going to prison. It's one of those odd things that you don't find very commonly. So it's something that you can always look back and say, I'm very fortunate to have had such a support from the family that actually was sustaining me even when I was in prison. And you always hope that you can always keep that bond very strong, even in families.
Yeah. And this strong spirituality that comes through from many angles, you're quite involved in church. You are a church elder at the Queensborough Congregational Church. Now umuntu bebeka amabhombu, and then on the other side, isondo kuyahlangana.
Dr. Nyati, you didn't prepare me for this, but now that you have asked it,
No, sengiyavala manje.
I did not see any conflict in that, because when you look into the life of Jesus Christ, he never came in to stay with the rich and with the people who had everything. He was actually with those who were downtrodden, those people who were poor, those people who were without resources, and he actually stayed with them. So I've always said it would not have benefited me, probably yes as a doctor, but I would have been only a doctor in this village alone, and not any other person would have been that successful. So the struggle was not about me alone being successful. It was about all of us getting liberated and all of us sharing the resources of this country, as it is really well enshrined in the Freedom Charter that this country belongs to all of us, black and white, and no one should claim authority on it unless it is based on the will of all of us. So it was actually working around that program. But anyway, there were people before me. I don't know how I missed recruiting you. I recruited some of your classmates, by the way, and you know them, to be part of the struggle and to be part of placing bombs. But there was no conflict in that. We wanted to liberate our country, and the bigger cause was just there, bigger than my individual achievements.
Yes. Ngiyabonga Dinangwe. I think you've shared a lot of something that people don't know about yourself, but also your commitment to the country, your commitment to the health of the people of this nation, your commitment to ensuring that the world is a better place for everybody. I liked what you said at the beginning in your book, that nakwandwana uyaphuma udokotela.
Yes.
And I'm sure ubaba Anthony and Mama Pauline, they are very happy, looking down at all the good that we have done. So I want to thank you, in spite of all the technical challenges that we had, but I enjoyed, just sharing, this interview with you and getting to, share with other people the little that I know. So ke Belesi, ngiyabonga.
Ngibonge kakhulu dokotela.
Ngibonga now your daughter, indodakazi, esizileyo, when we had some technical challenges, she came through very well, and this interview for me was very, 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 very enjoyable, because I was interviewing somebody I know very well. You were my big brother when I got to medical school, and when they took you away to that other place, just after getting your degree, it was not a nice thing to hear about. But anyway, God's plans, we never know about them. So thank you very much, and continue doing good for our country.
Okay, thank you so much, Dr. Fundilinyati, and thanks for the good work that you also continue to do for our country and exposing some of us to say some of these things. I really learn a lot from you, young as you are. Have a good evening. Thank you so much.
All right, thank you very much. All right.